Let's do those
Sorry.
risks. We have, I believe, the first one was blood clots. If you'd like to chime in on that, doctor.
There's an increased risk of deep vein thrombosis, which is blood clots in the legs. And there's an increased risk of gallstones. Now, these two can actually, in high-risk patients, if you want, they can be negated. The risk go back to normal if you give the estrogen transdermally as opposed to oral. We'll talk about that more later. The big one that women and doctors too worry about is the risk of breast cancer. And there's two important things to know about that. Number one, that it probably does increase the risk of breast cancer, but the risk is 1 in 1,000 approximately. So if 1,000 women take hormones for 1 year, there may be one extra case from taking them. But an important point is, in women who get breast cancer when they're on hormones, it may not cause it, it may just bring out a pre-existing tumor. So in people who are getting their mammograms regularly, they diagnose them early. So estrogen receptor positive breast cancers have a better prognosis as a whole, and there's less metastasis and less mortality.
And the last one, doctor, was cardiovascular complications.
The cardiovascular we've pretty well talked about. The increased there was no increased risk of stroke in the first 10 years after menopause on hormone therapy. And the strokes may be increased in women who are older, like 20 years or more after. And if so, it's on a factor of about 1 in 1,000. And there are so many other risk factors for stroke that come into play. And all of this said, it doesn't replace a healthy lifestyle. Exercise, nutrition, smoking cessation. I mean, the risk of lung cancer from smoking and cardiovascular disease is so much more than hormone therapy, and I think women have to put that in perspective.